Sleep apnea can be very dangerous if left untreated, and it's a condition that can strike anyone at any age. But the problem is, a lot of people just don't know they have it, so it goes undiagnosed. Joining me now is otolaryngologist Dr. James Ludwick, who specializes in sleep disorders. Good morning, and thanks for being here.
Hey, good morning. Thanks for inviting me.
Okay, sleep apnea. What exactly is it? Because a lot of people say, well, it's just when you stop breathing in the middle of the night, but it's more than that.
Well, that's not a bad description, but it's actually a short term for obstructive sleep apnea. It's a phenomenon that occurs when you're sleeping. Our muscles relax, our throat's a muscle, so our throat collapses in some people too much to where you're actually either not breathing enough or actually you stop breathing. And when you stop breathing, this forces, this is not life compatible. So your brain will actually wake up for a few seconds to what we call an arousal, and that arousal increases muscle tone to the body. And it increases muscle tone to your throat, which opens the throat, restores natural breathing. Then, of course, your brain's happy because you're breathing normally, falls back into sleep, then your muscles relax, and that cycle repeats itself over and over again during the night.
How common is this?
It's very common. It's about 5% of the population has sleep apnea. But people don't walk into my office saying, Dr. Ludwick, I have sleep apnea. They come in with a certain complaints and symptoms or signs, and a lot of those signs can be snoring. They feel like their sleep is restless. They wake up with a dry mouth or a morning headache. And the symptoms can be just anything you would expect if you're chronically sleep deprived, because sleep apnea causes sleep deprivation, but the difference is people don't know that they're sleep deprived, so they just go on pushing through the day, either using a lot of caffeinated products like sodas or coffees, and they may be irritable. They just don't feel well, but they don't know because it's happening when they're sleeping.
Now, let's say during the course of a day, someone's in a meeting, you know they're alert, you know they're awake, but all of a sudden,
right, you get these
the head just starts bobbing like an old Mike Tyson.
Right, well, the brain has something called sleep debt. It's kind of like credit card debt. It knows it's not getting enough rest. So the irony of us, what we do at the West Houston ENT and Sleep Centers, we don't help people fall asleep. We generally help them stay awake because people with sleep apnea have a very strong sleep drive.
Okay, there's a thing called CPAP that people use, and it's this device with a mask or maybe tubes that go up the nose to help you breathe. What does that do? And if someone needs it, does insurance cover it?
Okay, well, there are a lot of treatment options actually for sleep apnea. I tell my patients that throats are like faces. Everyone has a different face, and everyone has a different anatomy to their throat, but what CPAP does, it acts as a pneumatic splint to hold the airway open, so it breaks that cycle of the frequent obstructions and then therefore frequent arousals and fragmentation of the sleep, which is why you feel sleepy in the first place. But there are other options or surgical options. Because I'm dual board certified in ENT and sleep medicine, at our center, the West Houston ENT and Sleep Center, we are able to offer all treatment options depending on whatever's best for that particular patient.
Insurance, does it cover it?
Yeah, our lab, to get diagnosed sleep apnea, you need what's called a sleep study. And that's where you sleep in a facility. And we have a state-of-the-art sleep lab. It's very luxurious. And because our facility is part of our office, it's not actually a facility by the insurance. Most people, it's covered under their copay.
Interesting. Dr. James Ludwick, otolaryngologist.
Yeah, exactly. Good job with that.
Someone who deals with sleep.
Right, exactly.
Thank you for joining us. Great information.
Appreciate it. Thank you very much.